introduced, I was really excited and encouraged about the results. My doctors, they weren't real sold at first, and because I was doing so well on the other drug, they didn't really want to switch me. But I had to convince them and tell them, said, you know, listen, this is what I want to try. This drug represents so much to me.
I was able to hear different individuals that had gone through a trial of Tysabri. I got to hear what was going on with their lives before, during, and after. And when I heard the stories and I heard the people talk about it, I wanted to be a part of that. My doctor looked at it and looked at my situation, and we felt that Tysabri would be very good for me at this point.
We started Tysabri infusions in our office, and we've seen improvement in our patients with Tysabri. Not everybody, but the majority of patients have improved. What Tysabri does is block the white blood cells getting into the brain, so that the white blood cells that are the bad players cannot get into the brain and cause damage to the myelin and the nerves of the central nervous system.
Tysabri has been proven to positively affect key components of MS, frequency of flare-ups and disease progression. Tysabri may also positively affect the number of brain lesions detectable on MRI. Tysabri does not cure MS, and due to certain risks, it is generally recommended for patients that have not been helped enough by or cannot tolerate another treatment for MS. Tysabri has not been studied for use longer than 2 years. Also, Tysabri has not been studied in patients with chronic progressive MS.
What I do when I see a patient that is a candidate for Tysabri, I talk about the risks, benefits, and the possible complications. And one of the possible complications of Tysabri can be PML, which is progressive multifocal leukoencephalopathy. This is a disease that's caused by a virus. So we're very cautious about the medication, and we screen the patients each time they receive their infusions. So we go over a checklist.
Risk associated with the medication, you always take into consideration, okay, is taking this medication going to be detrimental or, and devastating, or, what are the benefits? Do the benefits outweigh the risk? And in our case, after sitting down and discussing them together and talking with her doctor openly about the trial phases and the risks associated, even potential of death and contracting the PML virus, we just felt that the benefit, the quality of life, outweighed any of those risks.
There are risks involved in any drug that you take, but I decided that there were too many good things to happen with the drug than to take a chance in having a relapse and not be able to bounce back.
What I like to do is talk to you about the TOUCH program and the risks, benefits, and possible complications of Tysabri.
TOUCH is a program specifically for Tysabri patients. It consists of 4 touch points: inform, enroll, confirm, and infuse. Tysabri is available only through the TOUCH prescribing program, which is a restricted distribution program focused on safety. Only prescribers, patients, and infusion centers enrolled in the TOUCH prescribing program can prescribe, receive, and infuse Tysabri.
My doctor provided me with a packet of information that I had to go through and then sign, saying that I felt comfortable with the decision to move forward on Tysabri.
This is an enrollment form that we'll read.
Your doctor will help you enroll. To enroll in the program, you will be asked to read and understand the patient medication guide, along with discussing the benefits and risks of Tysabri.
And any questions, give me a
Finally, you will need to complete and sign the prescriber patient enrollment form. Your healthcare professional will also review a series of questions you will be asked each time you go for a Tysabri infusion. Now that you are enrolled, you'll be getting a call from an assigned TOUCH prescribing program case manager. They will assist you through the process, including helping you find an infusion center.
Before the infusion, we always interview the patient to make sure they haven't had any problems. And if they have problems with memory or speaking, we want to make sure that these are symptoms that are not concerning to us.
The infusion will take about an hour. And then once that hour is over, I'd like to have you stay for another hour just so I can watch you to make sure there's no medical reactions that occur. And we
They
can take care of what
monitor
they do.
you during the time of the infusion, which takes about an hour. They check your blood pressure and your pulse, and there are periodic blood tests and
You could turn your head to
urine
the
tests that are done. And every now and then an MRI is done just to see if there's any changes. And I feel like it's very closely monitored.
How you feeling?
Good.
Good, okay. Well, then I'll see you in a month. Tell Mike hi for me.
Okay, I will.
And if anything comes up between now and then, give me a call.
Okay.
Tysabri's been wonderful because it's only one time a month, and I go in for a couple of hours, and it's a quick treatment that I get into.
Everyone knows I'm taking Tysabri. I always let them know when it's time to give my infusion, you know I have to go get my tune-up Friday. We kind of get a laugh out of it, you know, because I look at going to get my Tysabri infusion just like going to having my oil changed, you know, where they kick my tires, change the oil, and send me on my way.
When I'm reminded that I have MS through a relapse, or if my gait gets off, or my fatigue is a little heavier that day or that week, it's just something I know that I'm dealing with. MS is not going away. It's just I'm learning how to manage it, you know, constantly.
In our practice, we try to give hope to our patients with multiple sclerosis, because a lot of times people that are getting Tysabri have tried other medications or have failed other therapies or had side effects to these medications that they can't tolerate them. So their hope is Tysabri.
You know, maybe today I'm on Tysabri, but you know, maybe 10 years from now there's something that's going to be even better. So it gives me a lot of hope for the future.
The benefits far outweigh the risk for myself. You know, I'm not so much concerned about the risk. I know they're there. You know, I recognize them, but they're on the back burner. I appreciate Tysabri for what it is, what it does for me, and what it has done for me.
I have a great life ahead of me. I have a career and I have a great family, and so I'm on track. I'm just going to continue doing it, and I'm just not going to let MS stop that.
I'm able to full time, I'm able to play, I'm able to, you know, do the things that I love doing.
I just love life. Life is good, and I'm very grateful for that.
Important safety information. Tysabri increases your chance of getting a rare brain infection that usually causes death or severe disability. This infection is called progressive multifocal leukoencephalopathy, PML.